Hello viewers, welcome to Urologist on Air. So today we have one more great urologist from Nepal who is in conversation with us. So we are going to cover a few topics today. So my first topic is BPH. So sir, my first question is, first give your brief introduction to our viewers.
Good morning all of you, and thank you so much for giving me the platform. My name is Dr. Wes. I am working as a consultant neurosurgeon in Nepal Medical College Teaching Hospital, Kathmandu, Nepal. And yes, let's start.
Yes sir. My first question is from BPH. Why according to you are the cases of BPH on rise?
Regarding the point highlighted by you, right, why it is rising,
Yes,
and
sir.
why the younger patient also develop the symptoms of
Correct.
BPH, uh, it's a very interesting question because it is related to the lifestyle of the patient. Our general lifestyle, general sedentary lifestyle, and the associated comorbidities like early diabetes and sleeping habits and their routine lifestyle, their eating pattern of life and sleeping pattern. So actually BPH is a multifactorial disease. Its pathogenesis is related to multifactors. If a old concept of BPH was that when there is aging, there is a change in the hormonal pattern of the patient, and then there is a development of BPH. But that is also superimposed by multifactorial things like diabetes. If a patient has early onset of diabetes, that can also lead to
BPH.
BPH.
Yes sir.
Apart from that, sedentary lifestyle, their eating pattern, sleeping pattern, these are also modify the endocrinal control of a body and can lead to BPH.
Okay sir, thank you so much for answering that. We'll be moving to our next question. Why does it become so important to diagnose BPH at an early stage?
It's a very important question. So BPH actually it is a symptomatic complex of obstructive and irritative symptoms,
Yes sir.
and it affect the quality of life. So because BPH has to be addressed at early because it is related to the quality of life of a general population. Patient will have symptoms of weak stream, straining, hesitancy, and nocturia, frequency, urgency. So these symptoms have to be addressed according to the IPSS scores, what we call International Prosthetic Symptomatic Score, and we classify into the mild score, moderate score, and a severe score. And similarly, we also classify the quality of life for the BPH, and according to the quality of life and the score, then we need to intervene. So regarding the intervention, the first intervention starts with alpha blockers. What are the core of treatment of BPH? And if we have no any sexual dysfunction or patient has an old age, then we can also add on 5-alpha reductase, which basically function in decreasing the as a size of the gland. And so these two are the basic core treatment for the BPH, and it has to be started once there is the bothersome symptoms and the quality of life is disturbed. Patient have these symptoms, and then we have to start this medical therapy. So these are the top treatment options for the BPH as a medical therapy.
Yes sir. So sir, as it comes to interventions, I would like to add one more question. When does surgical interventions become necessary, and can we avoid this?
Actually, it all surgery, there is an absolute indication for TURP. That like if the patient has a hematuria due to the BPH, due to obstruction, if a patient has a secondary bladder stones due to BPH,
Yes.
if a patient has a recurrent infection due to BPH, or there is a secondary diverticulum formation due to BPH, or if BPH is leading to obstruction and then leading to renal insufficiency.
Yes.
So these are the absolute indications for the surgery. You need to intervene because then patient will have more worsening of the symptoms. So these are the absolute indication of surgeries. Apart from that, some relative indications like patient have a bothersome symptoms and not responding to alpha blocker can proceed to surgery. So these are the indication for the surgeries and has to be done timely.
Timely, right. Sir, Lifestyle modifications that are most for the people between the age of 40 to 50 to avoid BPH.
Uh, First, I would like to start with routine exercise. Okay,
Exercise. Okay.
yoga, stretching, any form of exercise. Uh, and apart from that, you told as younger age group, 40 years as younger people, they can have other sort of exercise like gym, cycling, stretching.
Yes, sir.
These also. So basically, it's all about exercises. Number one. Number two, so stress management.
Stress
Somehow
management.
stress is related to multifactorial endocrinal dysfunction. So not just the BPH, other as well. Their sleep pattern, mood pattern, their so number one will be exercise.
Exercise.
Number
Alright.
two, their diet.
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 Yeah.
Okay. So diet will be like, see, it's all about controlling your caloric balance.
Calorie should be avoided.
Caloric
Calories,
balance.
Yeah.
So patient, not just a patient, I would like to call in the general population.
Yes.
He or she should be able to control their caloric intake
Okay.
and outcome. So how much caloric you have to expend and how much calorie you are taking. That
So,
needs to be calculated.
on average, how much calories should one take
Around 1800 to 2000 calorie
per day?
per day.
Okay.
So it depends upon weight and height, BMI overall. So I'm telling a rough figure for around 60 to 65 kg, 5 to 7 feet young guy or lady. So caloric intake and output should be measured. It should be balanced because
Balanced,
ultimately
right.
it is affecting to your obesity and then all your hormonal functions. So first I told about the exercise, which can be in any form, like stretching, yoga,
stretching,
training,
gymming, cycling.
cycling, all
Yes,
these
sir.
things. Then second will be diet.
Diet control.
Then the third will be stress management.
Stress management.
So ultimately the stress management should be by meditation.
Meditation,
Again,
yeah.
again that comes from yoga, exercise
Yoga,
and all that.
correct.
And it also should be like coping strategies, your friend circles, your family matters, the financial problems. It all should be addressed. So these are some basic measures, or I should call for to manage not just the prostate disease or any disease related to our system. So these have to be addressed on timely.
Yes, sir. Sir, one more question I would like to add from the next topic, which is kidney stone management, because most of the people are suffering from kidney stone
Yes.
and various diseases related to it. So one more question I'd like to add: why do you think the number of cases of kidney stone are increasing these days?
This is a very nice question, and you have pointed very rightly. The number of cases are rising just because of our dietary habits. Okay. Number one is, I would like to say that the drinking pattern of water has been disturbed. Most of the patient will have sedentary lifestyle, having some fast food, consuming some beverages or cola
Beverages.
drinks, color drinks.
Yeah.
So apart from having the normal routine water, what we used to have, decades or 10, 20 years back, what our parent used to teach to have a lot of water. So that has been replaced by some sort of by Coke,
Coke
Pep,
and
this is
drinks, beverages.
all soft drinks and this. So number one will be like because one of the major factor that is contributing to stone is because of
These kind of drinks.
drinks and less consumption of water.
Water.
Yes.
So, sir, how much water one should consume in a daily basis?
At least it should be around like urine should be around 1.5 to 2 liters.
Oh,
That much amount of water has to be consumed. So it turned out to be around 3 to 4 liters.
3 to 4 liters.
But again, it varies according to the the geographical condition, the climate. Like
Okay,
if it is summer, you can extend up to 5 liters or 6 liter even. And if it is a winter, it can be shrinkage to 3.5 liters. So overall idea is that you need to be hydrated.
Yeah.
And the second thing also you need to know about hydration is that it should be like a circadian drinking. There is a term circadian drinking. It means that you need to consume water in every regular basis, every 2 hoursly
2 hours. Yeah.
gap. It is not that you had 1 liter of water early in the morning and then you come from office and had 1 liter in the evening. So that's not the point. It should be in the circadian pattern. It should
Yeah.
be continuously. It should be
Continuous.
drinking and then passing the urine. The basic idea is that you need to be hydrated,
Hydrated all the
24
time.
hours.
24 hours, correct.
And the color of the urine should be clear.
Clear.
It should not be alloyish
Yeah,
or darker.
yellowish, no.
That is a sign of dehydration. Whenever the patient or whenever anyone is dehydrated, the urine color becomes darker,
Darker.
yellowish dark.
Yellowish, yeah.
So that's the point to be noted by everyone. That's I am under hydration,
Okay. Yes, sir.
dehydration. Sorry. So
Yes,
it
sir.
should be hydrated.
What has been the most challenging case of kidney stone that you have dealt with, and how did you remove the patient's stone?
I still remember the patient. She was 42 years female with a bilateral staghorn stone
Oh,
and comorbidity of diabetes and ischemic heart disease and hypercholesteremia, thyroid. So multiple comorbidities and with a bilateral obstructing staghorn stone, and somehow her renal function was preserved. So I had to go for a multi-track PCNL for one side, and then again with a gap of 6 weeks again with the other side. So it was a very challenging case for me.
yeah, it was. Thank you so much, sir,
Thank
for
you.
your kind words and for educating our viewers.
Thank you so much.
sir.
Thank you so much.